Good morning and welcome to the Cornerstone Legislative Compliance Update. Before we get started, Cornerstone would just like to wish everyone a happy Veterans Day and thank you to everyone that has served our country. Today, we're lucky enough to have the Legislative Chair of the Ohio Association of Health Underwriters and Vice President of First Insurance Group, Barb Gerken, for a federal and state legislative updates that you need to know about. And with that, I'm going to hand it over to Barb.
Thank you, Nelson. Good morning, everyone. Again, I'm Barb Gerken. I'm from the Sylvania, Ohio area, and I will be presenting a variety of topics today. We do want to make sure that you're able to get all of your questions answered, so feel free to put those in the chat bar. We would ask that there are going to be some topics that we know people are sitting on polar opposite views with regards to whether or not we should be proceeding. Please try to keep the questions to factual items that we can address, just to keep that box clear for those who are responding to questions. I will stay on the line as long as possible to answer questions, at least till 10:20 if needed, and then anything we don't answer during the session, we will follow up in writing to everyone afterwards. So feel free to add those questions to the chat bar. So as you can see, we have a lot to cover. We're going to talk about both state and federal guidance, and also some things that are up in the air with regards to the employer mandate for vaccination, and again, answer as many of your questions as we can regarding those items. So we're going to start with some delays that were announced in both the surprise billing rules and the transparency and coverage rules. And just as a quick reminder, the surprise billing came under the Consolidated Appropriations Act of 2021, and specifically what's known as Division BB, which is the No Surprises Act. The transparency and coverage final rules were released in October of 2020, and there were provisions that were implementing over a few years following the passage of that legislation, and there have been some minimal delays in that as well. As a reminder, with the transparency and coverage rules, we'll just briefly touch on them and the delays, but this will apply to all group health plans and health insurance issuers in both the group and individual market. It does not apply to grandfathered plans, HRAs or HSA accounts, accepted benefits, like let's talk about like the critical illness and accident, things of that nature, healthcare sharing ministries, and short-term limited duration plans. So again, lots of things packed into both of those rules. The delay in implementation came in one release from the Department of Labor, Health and Human Services, and IRS. So we're going to look at some of these provisions and talk about why they're delayed and how long of a delay we receive in each of those. So the elimination of gag clauses goes back to how do we get information in front of members, patients, to be able to help them make decisions about their health care and where they're going to receive services. So the elimination of gag clauses says that neither a carrier nor a provider, pharmacist, can have anything in their contracts that says that reimbursement rates or fees cannot be disclosed. So those we know that that's going to cause a lot of disruption in current contracts. It was originally supposed to be in place 12/27 of 2020, but they have delayed that pending some additional implementation rules on how that's to be done. The mental health parity comparative analysis started in February of this year, and it is not delayed. Super important that an employer be able to answer questions about what are known as non-quantitative treatment limits, NQTLs, and I'll give an example. So it says that if I have step therapy provisions for prescriptions, it can't be any more restrictive than it is in the health, in true medical services. So your plan must be equal in its treatment of mental health as it is in medical services. There have been audits done of our clients over the past year, and they're taking an approach of let's try to correct, but it is very important that an employer be able to answer to their group health plan as to whether or not they're meeting those guidelines. So again, no change there, and it began in February. In my estimation, most employers are going to need to lean on either their carrier or their third-party administrator to be able to answer those questions. So hopefully they're already in conversations with the carriers, making sure they're in compliance. The third item, the attestation regarding elimination of gag clauses, that again ties to that first bullet, so it is also delayed pending those final regulations. The disclosure of broker consultant compensation, we are going to discuss that further in the presentation. The due date is 12/27 of 2021, and there are no delays in that, even though we don't have all of the guidance that we need to implement that, but we'll talk about that in greater detail when we get to that section. Pharmacy benefits reporting, this was both from the surprise billing rules as well as the transparency and coverage, finding a way for an employer to display the costs and the fees that they've paid out for prescriptions is going to be a very difficult process. This particular piece is under the No Surprises Act and says that an employer, whoever is the group health plan, has to provide a listing of the benefits that they provided under their pharmacy contract, and we know again that most employers wouldn't have the ability to do that today. It will have to go back to the carrier or the third-party administrator, so it's delayed until they can find a way to make that work appropriately. The surprise billing protections, we know that all of the pieces and parts aren't in place from a provider standpoint or a carrier standpoint to completely put these new rules into place January 1st. So in essence, what the departments are saying is do the best that you can. There is going to be a minimum floor of what we require, specifically that they can't charge a patient for those over UCR amounts or the balance billing amounts. But all the other procedures make a good faith effort, and they won't be penalized during this first year as everyone's trying to put their systems in place. ID cards from both the federal laws and our state surprise billing rules, the carriers have to come up with a way to add additional information to their ID cards. From the federal law, the initial guidance said carriers have to put all deductibles and out-of-pocket amounts on the ID card, both in and out of network. So we all know what an ID card looks like today. It might be easy to put a deductible and a major out-of-pocket, but how do you list prescription drug deductible? How do you list an emergency room deductible? It's a lot of information to try to get onto an ID card. And from the state law is requiring that each identification card either say ODI or DOI to signify that that member is subject to the Ohio laws and not the federal rules. So carriers are trying to figure out how are they going to readjust their ID cards to get all of this information in today. So the delayed rules say that at the very minimum, you at least have to have the major deductible and major out-of-pocket listed on the ID card. So carriers are trying to figure out how to put that in place. Advanced explanation of benefits is just exactly what it sounds like. The EOB that we today get after services, we have to find a way to provide that before someone has a service. We all know that those are going to be difficult until both the providers' offices and carriers have their systems ready to accommodate that advanced notice of benefit payment. So again, it is delayed. They're saying do the best that you can to get a reasonable cost estimate to the person ahead of time. But the long-term goal is that someone walks in and they get the EOB that they get today 2 to 3 months after service, they're going to get it before they head into the office. The price comparison tool and guidance, that one I believe will be held indefinitely under the No Surprises Act, because we have the transparency and coverage rules that are much more extensive, and carriers won't be able to put both in place. So they've delayed it under the No Surprises Act, and my estimation is that they're going to revert to the transparency and coverage, and we'll talk about that in a moment. An accurate provider directory is also delayed. They did go away from the initial language that would have required us to go back to printed directories, but this one basically says a provider and or an insurance carrier has a specific number of days to get information back and forth and have their online directories updated within that time period. In the interim, even though it's delayed, they're saying that if in good faith someone went to a provider that was listed in a provider directory, whether it's online or in paper, that carrier has to allow that to be paid at the network level. Continuity of care, I don't think will be a huge issue, but it does say that there are very specific rules in place for when a provider drops out of the network, how to allow that a person seeking services from that provider to continue care until they can reasonably move to another provider. There are lots of rules and policies already in place with carriers. They put it on delay until they can come back and look at that a little more in depth to see if what's in place today meets the guidelines of the law. As a very quick reminder on the transparency and coverage timeline, again, this was released in October of 2020 with provisions that would come in place over a 4-year period. In 2022, January 1st, that was the first major due date that said from a health plan, meaning our employers would have to provide lists, machine-readable files for both their in-network reimbursement costs, their out-of-network reimbursement costs, and prescription. Super complicated formulas for each of those, and so there have been some delays on that, and we'll get to that in the next slide. In 2023, the systems were supposed to be in place that allows a member to go to a website and look for the 500 shoppable services, and these were services that are the most common today. It might be a tonsillectomy or an MRI. Someone puts in a CPT code or a general description. They give the provider name, and it would come back with a response electronically that says, here's where you are in your deductible, here's where you are in your out-of-pocket, here's how much is reimbursed for that specific provider, and here's your total out-of-pocket for that service. So we know that's super detailed, and our employer groups don't have the ability to build these capabilities. So what we anticipate is that they're going to have to contract with someone, whether in a fully insured, it's back to the carrier, or a third-party administrator. Someone else is going to have to administer this information because a group just doesn't have access to the reimbursement rates. So it will be complicated. And then in 2024, the website has to be available for all services. So again, 4-year period to get all of those items in place. The delays are on initially the machine readable files. So it again spoke to that January 1st effective date in the legislation. Now they're saying that for the in-network and out-of-network rate files, it's going to come up as each group renews starting 7/1 and after. So on their plan year, the employer will have to start putting those in place and having those machine readable files ready. The prescription drug they've realized very quickly is more complicated than they originally anticipated. So that is completely on hold until they come back with further guidance. But there is no change to either having the system ready for the 500 shoppable services or all services. But again, the bigger point to all of you is that the employer plan, the way the language reads, is the employer who sponsors the group plan who has to get all of these things in place. In our estimation, it's going to be a vendor. So just like with the 1094, 1095 process, we all struggled with the first year trying to figure out how we were going to do it. And then very quickly, vendors were popping up all over to help us meet that need. We anticipate it will be the same. Vendors are going to take these machine readable files and find a way to put it in place for our clients. So the broker disclosure rules is probably one of the most frustrating parts of the legislation. The rules didn't the law didn't specify that there was a time period where final guidance needed to be submitted. So we're sitting with this December 27th effective date that we don't have all of the information and guidance in place to be able to actually put this into practice. So we're going to talk about what the rules say today, and I'm going to give you some opinions on what we've done, but we will need to wait for further guidance. And just so you're aware, Marcy Buckner of the National Association of Health Underwriters had a call with the Department of Labor last Thursday, and they discussed at great length some of the concerns that we have. So they gave some verbal opinions, but it's nothing that we can run with concretely. But they're saying make a good faith effort this year, and they will come back with further rules and guidance shortly. So this was tucked into the Consolidated Appropriations Act of 2021, and this specific provision says that we as brokers, consultants, agents, whatever your terminology is, if we're receiving at least $1,000 of compensation over a plan year, whether that's direct or indirect compensation, then that has to be reported to your group client reasonably in advance of their renewal date. So direct means anything that the client is paying you directly for. So in our circumstance, we have an online benefit service that system that we charge for. That would be a direct compensation from the client to us. We have consulting agreements with our larger groups where they're paying us directly, nothing from the insurance company. That's direct compensation. Indirect is all of those other items where you're receiving commission from a carrier, a third-party administrator, a vendor. So if you have a COBRA arrangement with someone and they're paying you comp on any clients that you bring in, that would be indirect as well. And all of our bonuses, overrides will be included in that as well. So you can see this list of services. I want to keep focused on the fact that it really applies to medical, dental, and vision. But if any of those services that you see listed in that paragraph, if those somehow touch those benefits, medical, dental, vision, then it has to be included. So again, back to my example, our online benefit services, that's tied to the medical, dental, vision, so it has to be disclosed. COBRA services are touching those processes, so those have to be included. If you're helping with wellness services and that vendor is giving you compensation, all of those have to be included. So this is going to be the tricky part as far as we're concerned. So we have 10 offices, lots of producers, and it says that it does not include non-monetary compensation valued at $250 or less in aggregate over that group's plan year. So let's say, for example, Medical Mutual takes one of our producers to lunch. Someone else gets taken to a ball game, a golf outing, any kind of event. I have to find a way to track all of that and somehow find a way that do we spread it out over everyone's clients in the agency? Do we spread it over just that producer's clients? So those are the ones that are going to be very difficult, and we just don't have enough rules today to say how is that going to factor in. It could be expressed as a monetary amount, so the full dollar amount, a formula, or a per capita. So what our intention is to take basically a checklist that says you've selected medical, dental, vision, online benefits, and whatever the case is. And then under each, we're going to say, here's the carrier that you've selected. Here's the number of contracts we see that we're writing at the time that we're signing the contract. And here's their per employee per month or their percent of commission. And here's where we anticipate the initial amount to be over your plan year. That would satisfy a reasonable good faith effort. Another way which the Department of Labor gave a verbal nod to, again, this is not in writing, so be careful with this guidance, but they said they would see you putting the carrier's commission schedule in your agreement as meeting the guidelines initially. So that would also be considered a good faith effort. We really should include also a disclosure that additional compensation may be earned. So our example would be, based on our book of business, we might get a bonus from a carrier. We track it today, but now we have to go back to that group that we gave the estimate to within 60 days to say, hey, we received a bonus amount, here's what we received, and that's in addition to what we had initially disclosed to you prior to you signing the contract. So the description of service, this line prompted us. We've been talking about it for years. So a lot of us have contracts with our clients, our larger clients, because they require it. Most of our small group clients don't have any type of service agreement. So what we've put together is a service agreement. So it in general says, here's what we do, here's what you do, and then here are the services that we're providing. So kind of, again, that checklist, here's what we're doing for you, whether it's consulting, whether it's true broker services, whatever the case is, and then that person signs off with an addendum that has all of your rates listed. So there has to be a description of service. We think that could be done through a brief service agreement. And then a statement that you are not a fiduciary is super important. And again, that initial to me would be just what you know at the time that you're selling that contract. So the only thing that you are certain of at that time is the per employee per month or the percentage of premium, depending on the product that you're recommending to the client. And then a brief statement that says, hey, by the way, we might receive bonuses, incentives, et cetera, throughout the year, and we will disclose those at the time. The Department of Labor also said that you could, let's say you've had a group for years and you maintain a pretty steady block with a carrier and your bonuses are anticipated to be about the same, you could put a statement in there that says, last year we received this in bonus amount, and then you wouldn't have to do the 60-day notification. So either way would be acceptable. So this is the part that has been very confusing, and in Marcy Buckner's conversation, she said that almost 20 minutes was spent just on the effective date. So it says when the contract is entered into on 12/27, but it doesn't. In most cases, a client isn't signing with us as a broker; they're signing with a carrier. So the contract they're signing is usually the carrier's application. They're signing a proposal, but there's nothing today that signs them with us. So they're saying that 12/27 date is the date they're entering into contracts with you as the broker. So in our estimation, the new service agreement will suffice because they're signing that contract with the addendum with the disclosure rates. But it says it has to be delivered reasonably in advance. And we've shared with the Department of Labor, many of us have groups that come to us on the day before to let us know what their plan is for their carrier selection. So again, it's reasonable. If the group hasn't given you information, it's not reasonable to get it to them any sooner than that day before. And again, we've talked about anything that's changed, whether the carrier makes a change in their per employee per month, there's any kind of change in compensation with regards to bonuses, those all have to be done within 60 days. And if you don't provide this, the group is required to report you for not providing. This is part of ERISA rules now, and the group is required to report you, and there are fines attached. They're saying that there's rules required no later than 1 year. That doesn't help us much for this year. So in my estimation, do your best to put a short service agreement together that says, here's what we're going to do. Make sure there's a statement in there somewhere that says you're not a fiduciary to the plan, and then an addendum with here are the services we're providing and the basic comp that we think we're going to receive. And you should be in a good faith effort. So my recommendation, get all of your January groups done quickly and try to keep it so that it's next year when we have to do the majority of the work. I'm briefly going to touch on the leaves of absence under COVID because there was some additional guidance released by the IRS for things that an employer has to complete during tax season. So just as a quick reminder, all of the time off and requirements for paid leave ended as of January 1st. Everything after that period became voluntary, and two laws affect that. So the Tax Relief Act, under the Consolidated Appropriations Act of 2020, extended it from January through March 31st. And then the American Recovery Act had April 1st through September 30th. So two laws, two different time periods. So now they're saying that as of the W-2 reporting for the 2021 period, they need employers to separate those time periods and indicate any amounts of paid leave that was provided to those employees under the different provisions. So the next slide is going to look a little bit messy, but hopefully you can print those out and use it as a guide. So each one is going to be labeled separately if it's under the CAA or if it was under ARPA. And then each one, they're going to have to say, you know, I gave them sick leave wages for the $511 per day for sick leave or the $200 for the extended Family Medical Leave Act. And they're going to, again, so if they had someone that crossed the lines of those two periods, they're going to have to indicate all of that on the W-2. So just make sure if you have any clients that were voluntarily allowing this paid leave, that they get those on the W-2 for 2021. A brief marketplace update. These changes were part of the benefit and payment parameters update for 2022, and it basically says that for this year and every year going forward, there's now an extension in the open enrollment for marketplace coverage. A person has to enroll by December 15th if they want the January 1st effective date, but open enrollment will continue through January 15th of every year. It then would go for a February 1st effective date if they enroll between December 16th and January 15th. And ongoing, there's a new SEP for anyone who's eligible for any kind of tax credit through the marketplace if they earn up to 150% of the federal poverty level. I received a lot of calls on this one, particularly regarding the additional services that navigators are allowed to perform. The biggest one really is that third bullet that allows them now to discuss basic concepts and rights of health coverage. And this is more on, you know, how to look for a provider, how to use their benefits. So we will watch that closely to make sure that they're staying under the original guidance of how far they can go into a conversation, but that was added under this newest bulletin. The increased marketplace user fee is back to the carriers, so there was a slight change in that, but that again goes back to the carriers, not to individuals or employers. One thing I do want to add at this point as well is if you haven't looked at some of the domestic policy changes that Congress is trying to work through for this reconciliation, one of the things that we're really concerned about is there's a potential, and it's bouncing all over, by the way, so take this with a grain of salt, but for employers who are subject to the employer mandate, it appears that they're trying to change the affordability levels to a flat 8.5% with no indexing. So that's of serious concern to all of us who are managing those larger groups, because we have a lot that are riding at the current lines today, and it would be a very big drop. It would basically render a lot of our current plans unaffordable. So we'll watch that closely. So now we get into the really fun topic of the employer vaccine mandate. And again, I know people are sitting on polar opposites of this, so and this could be a whole session in and of itself. So I'm going to try to keep this as brief as I can, and know there's a lot of detail behind what I'm providing today. So if you hadn't had a chance to jump on one of the vendor webinars, it would really help because there's a lot of detail packed behind these. So OSHA last week released the emergency temporary standard. By design, an emergency temporary standard cannot last more than 6 months. So the ETS began with a whole explanation of why they were trying to put this in place and what questions they had of the public in order to put a permanent standard in place. So today it says it applies to employers with 100 or more employees, but part of the questions to be answered for the permanent standard asked about how best to be able to put it into the under 100 employer market. So it doesn't say that under 100 is out of the equation right now. They are saying that they understand that administratively it would be more difficult for an employer with less than 100 to put it in place, but it doesn't mean that they won't be included. That 100 employees, many of the questions that we had were answered with regards to how do you do common ownership, who's considered together. So they didn't use common ownership, they called it joint employers in the regulations. And it says, and I'm going to use our own personal example. So we have the agency with 95 employees, but we have the bank who we are commonly owned. We have the bank who has 1,400 employees. Because we share our safety matters and our HR, we are going to be, the agency will also be included in the mandate. If for whatever reason our HR departments ran completely differently and our safety standards were differently, we could potentially go off on our own and say we aren't subject to it. But we do run all of our HR policies and safety procedures together. So even though we're less than 100, we will be included in this mandate. What is required? An employer has two options. They can say, we want the vaccine mandate only. Everyone's going to be vaccinated unless they have a religious or medical exemption. Everyone else, we're going to end employment for that person. They also have the ability to say, we think that's too harsh. We don't think we're going to be able to keep employees based on that. So we're going to say we want everybody to be vaccinated, but if you choose not to, we're going to allow for the alternative of weekly testing, which brings a whole new set of complications and costs, which we'll talk about that in a moment. And the employer would be required to provide 4 hours leave of absence for each vaccination dose, and then any leave for potential side effects. So if somebody needs to take the day off afterwards, it has to be paid leave. And they can, under those rules, make the employee use any of their existing sick time, PTO time in order to do that. They don't have to give them a separate bucket of time. It does preempt any state or local ordinances that prevent employers from implementing this standard. So we know that there's lots of states that have already passed legislation that says you can't do a vaccine mandate in our state. Here's why. This will preempt all of those laws. The permanent standard is required. So this policy, as we know it today, if it goes into effect, will only last for 6 months. At that point, they will be required to put the permanent standard in, or the other one goes away altogether. So today we know that the day after it was released, there was a lawsuit filed, a challenge filed in the 5th U.S. District Court of Appeals, who temporarily stayed the standard. So Monday they were waiting for OSHA to respond to questions. Tuesday they were waiting for the plaintiffs to come back and respond to OSHA's response. We anticipate, because of the due dates of some of the items, that we should have an answer, I would say, by the end of this week, early next week. What complicates it as well is now in each of the other circuits, there have been other lawsuits filed. So what likely will happen is they will all be combined into one suit from all circuits, and then they go through a procedural process to decide who's the lead. But we do anticipate that they'll take all of those different circuit court challenges and place them into one federal challenge. So if it proceeds, the people who are exempted, employees who telework, and in the language it's very clear that it means permanent full-time telework. That person never steps into your office. It doesn't account for the people in our scenario where they work most days at home, but we call them in for meetings, or you have to be in on Fridays, whatever the case is. That person is not included in this exemption. Employees who do not report to a workplace where others are present. So if we have a larger employer and they have an office with just one person, or one person is in one specific section of a building, it wouldn't apply. It would apply to the whole company, but not to that specific employee. And those who work out exclusively outside. So those of you with construction companies, it does specifically say that it has to be exclusive outside work. So that would mean that the employees can't all drive together in a work truck to get to the site. Those employees would not be included. If you're having work meetings inside a building before you go to outside work, that is not included either in this exclusion. Employees who are included in the mandate. So unvaccinated healthcare workers who are not covered by the healthcare ETS today. So those of you with provider groups, that healthcare ETS only applies to people who are working with patients. So if we had a hospital system where their office workers today weren't included, they would be included in this part of the legislation, or I'm sorry, emergency temporary standard. Someone who was previously infected with COVID, that has been a big question. Would they allow someone with antibody information to be able to waive? And the answer was no. So even if you've previously been infected with COVID, you will be required unless you have a medical or a religious exemption. Employers who are not subject to this rule, anyone who's covered under any of the other guidance that's already out there. So the healthcare workers have an emergency temporary standard. Federal contractors and subcontractors have one today. So those employees would continue to be guided by those ETS standards, not this one, unless they have employees that weren't impacted. Some of our state and local government agencies are also not included. So if there are 26 states today who have what are known as OSHA approved state plans, and in those 26 states, a county or public entity would be included in their guidance. Ohio does not have a state plan, so our county groups, our city groups, some of our schools, they are not going to be included in this legislation because they are not subject to OSHA rules today. In Ohio, they've adopted a lot of the standards, but they aren't required to do that. So unless they change their rules, Ohio is not included today. So Michigan, I'm sorry, I have Ohio in there. Sorry, that's a typo. So it's Michigan, Kentucky, and Indiana do have state plans. So if you have groups in any of those states that are county, city, they will be included in this guidance. The employer responsibilities, you must have a basic written plan that's put in language that an employee can understand. So it has to state, you know, we as an employer have elected vaccinations only, or we as an employer have elected vaccination status and the weekly testing, and they have to go into detail on how each of those provisions will work, what's required of employees. And I will give you an example today. Last night, our HR team sent out the beginning looking for our vaccination status. So they told us, here's what we plan to do, here's where we want you to put your documents, and here's how we're going to verify them. So we're starting our process in bits and pieces, just trying to be ready in case it does go into effect. Very detailed record keeping, but this is unlike our medical records today, where we have to keep them for extended periods of time. They're saying they have to be saved for the 6-month period that this ETS is in effect. So if I take a vaccination card or I'm taking weekly testing results, I have to store those separate from the employees employment file, and I have to make sure that they're kept secure according to all of the current HIPAA guidelines for medical records. I also have to put together an employee roster that has every single one of my employees listed, and it says yes or no. They are either not vaccinated, partially vaccinated, or fully vaccinated. The interesting piece about this is that if OSHA comes to ask for that roster, the employer has 4 business hours to present that roster. So if this proceeds and is going to be implemented, that's the first thing I would tell your employer to get in place because they're going to need it in a very quick time frame. 4 business hours is not a lot of time to put that together if you haven't already. The employer will also have to notify within specific time periods if there was a hospitalization or a death attached to a workplace incidence of COVID transmission. So there will be specific time periods for that as well. The costs, under the employer side, they're going to have the vaccination expenses, which they really already have today. So again, everyone should be provided with the ability to get a vaccination at no cost. 4 hours of paid leave for each vaccine dose. So they did a very big calculation of drive times, et cetera. So 4 hours was where it landed. And then what they're calling reasonable time and paid sick leave for potential side effects. So that's a little bit of a gray area, we all know. So we have one employer that's really struggled through the pandemic with people abusing some of this time off. So they're going to have to come up with what their definition is of reasonable and allow that paid sick leave. Again, just a reminder that they can use buckets of time that are already available, whether it's sick time, PTO, but if they don't have a paid leave program, they will have to implement it just for this portion of the ETS. The employee will be subject to the weekly testing expenses, and then face masks. Normally under OSHA rules, if there's a guidance that says this has to be done, and here are the safety requirements and materials that you'll need to put that in place, normally it falls back to the employer for those costs. This particular ETS went into great detail about the fact that the goal is to get everyone vaccinated, and the weekly testing and wearing a face mask is the least desirable. So in order to have some incentive, they put that cost back to the employee. So again, face mask would be the responsibility of the employee to pay for those costs. So we know it's in a stay. There's a very likely possibility that it's going to be permanently stayed, but we don't know that yet. So because of the tight time frames, you have December 4th to have your roster ready and details about who is vaccinated and who is not, and then January 4th to fully implement the weekly testing and or any of the exemptions that you have allowed within the organization. So with a very tight time frame, we're still telling employers you unfortunately have to proceed as if it's going into place until we know it isn't. So what we would say is, are they going to do the vaccine mandate only? And we know all the complications that come along with that, but what is their choice? They have the ability to say by class of employee, and I'll be more specific in a moment, that here's what we're going to do. So we might say anyone who has client contact or public-facing responsibilities, that person has to be vaccinated. That's the only thing we're going to accept. But maybe our internal employees that never have client-facing responsibilities, maybe we're going to allow them to do the testing as an alternative. So they have to, as an employer, make a decision, what will they do with their policy? And then will they do something separate for remote workers? Maybe take certain people to fully remote to get around the weekly testing rules. They'll have to have that policy in place. How are you going to communicate it? Again, it has to be in simple language that anyone would be able to understand. And just for your reference, when the federal government uses simple language, they're saying that it should be on a 5th or 6th grade reading level. Who's going to collect the data? And that's particularly, again, I'll use our example. Between the bank and the agency, we have 50 plus locations. So it obviously can't be the HR team. Who has to collect the data and who has to verify vaccination status? Today we've decided that our managers will be the one to verify that the information is correct, but we haven't decided on the testing. And then how are you going to store your data, making sure that it's secure under the PHI rules? And the biggest part is, what are the potential staffing ramifications? We all have at-risk employees that we know, our agency is no different than the general public. We probably stand at about 30% people that aren't vaccinated today. Are they willing to get the vaccination, or are these employees at risk? And what will be our answer to that if they truly are? I've had many employers asking me about surcharges, and we're going to talk about this in both language of carrot versus stick, which will make a big difference, especially for larger employers who are subject to the employer mandate rules for affordability. So in October, early October, the tri-departments released an FAQ that went through a few random items, but then mostly focused on the surcharges. So the first part said that, again, confirming that all non-grandfathered plans have to cover the COVID-19 vaccinations as of January 5th. I'm not sure why that was in there. Apparently there was someone that was not covering that, but most of our plans already have that fully in place. But the bigger news was the ability for an employer to either, as an incentive or a surcharge, say your premiums will be different if you are vaccinated. And if you're familiar with the wellness rules, there's one part of it that's called an activity-only wellness program. and that, in essence, says that it has to be reasonably designed to prevent disease. And in the department's estimation, keeping people from getting COVID is part of that. And so you've met the first bullet immediately. The second one says that you've provided a reasonable alternative standard to qualify for the discount. So this would mean that if someone has a medical or religious exemption reason that they can't get the vaccination, that you've allowed for them to either telework, you've allowed them to be in an area that's somewhat confined, that they're wearing masks, something that has a reasonable alternative for those who medically cannot meet your guidelines. And it also provides for you have to have a notice that goes into detail about what that reasonable alternative may be. So each employer is going to have to make a decision. Would they have the ability to allow people to work remotely? And if not, what are the other things that they could do within that office setting or factory setting to allow for the reasonable alternative? So the reward, the way they stated it is, I thought, a little bit misleading, so I want to talk about this bullet. So it says the reward the plan provides in connection with the vaccine cannot exceed 30% of the total cost of an employee-only coverage. So it's not looking at what the employee pays, their contribution. So if the single premium is $500, they can't charge more than 30% of the $500. It says for the vaccine, but keep in mind that that 30% is on all wellness activities outside of smoking cessation. So if somebody already has a wellness program in place with incentives, and they want to add something new in for vaccinations, they have to make sure that in total the program costs don't exceed 30% of the employee-only coverage. And they have to allow the person once a year to qualify for that standard. In my estimation, if the goal is truly to get people vaccinated, then I would allow them to come back at any time during the year with their vaccination status and get that change included. And it seems odd that I would have to address this, but we've had several clients ask ourselves. So health plans cannot deny benefits based on vaccination status. So no, as an employer, you cannot remove coverage from someone who refuses to get vaccinated. You can't deny hospitalization services just on the COVID infection. None of that can happen. So they did specify that in the rule. For those of you with larger groups, be careful on how you present this information to your employees, carrot versus stick, and how that impact may change the affordability of your plan. So in essence, the rules say that in that first bullet, if you have a $200 contribution today and you say we're reducing that by 25%, you're taking the $200 and that's your affordability calculation with regards to the plan's affordability. On the flip side, in bullet 2, if my contribution is $200 and I decide I'm going to add a 25% surcharge, then the $200 plus the $25 surcharge is now considered your employee contribution for the calculations. So for groups that are riding that line where it's exactly at the affordability percentage, they're going to have to take a look at that before they put it in place. These are not recommendations, so I'm not recommending certain vendors. I'm just telling you, based on some of the work that we've done, we were trying to find vendors that would be able to answer a need for our employers as to where would they store all this vaccination information and how could they capture the weekly testing, et cetera. So we spoke with several vendors, several payroll companies. A lot of the payroll companies have found a way to add it in. So this is just an example of Paycor. They've added a new tab to their employer administration site that allows them to capture both the immunization status and there's some information on the test results as well. So a place for them to store it and store it securely. Another vendor we looked at was IncentFit. They've been doing wellness activity and incentive tracking for many years. They added flu vaccinations a few years ago, and they just recently added the COVID vaccination. So this is an app that would allow employees to upload vaccination status as well as weekly testing results, and the company would verify, when somebody uploads their card, they're going to verify that they've received both doses. If it's Moderna, they're going to make sure they've gotten the Johnson one, the one shot. So they will verify the records and then the weekly testing, and it also has an admin portal that would allow them to have that weekly testing result available in a report. So if we're telling employers that you're starting to consider this is really important, where are you going to store it and who's going to help you collect this data? So I would look either at your payroll vendor or an outside vendor if it's not available through your payroll. Make sure you have a way to meet the needs of this employee roster and or the weekly testing that OSHA may come in and ask for. And the last thing I want to touch on is affordability percentages. That is changing for 2022, again, for large groups. It says that an employer plan, the contribution that you require of your employees on the single-only coverage cannot be more than 9.61 of the employee's household income, which again was changed to W-2 wages for the purposes of that employer mandate. So that is a decrease from 9.83%. And again, in that domestic policy that they're working on today, it appears they're trying to push forward with an 8.5% that would remain standard without indexing. So we'll watch that carefully and let you know if that changes. But I've included some examples because I get a lot of questions on it. So if it's W-2 affordability, I ask them to take their lowest income earner, give me their annual salary, and then we multiply it by the 0.0961. It's $2,883 annually, or $240.25 monthly maximum. So if they take that lowest income earner, they'll get the affordability for that person, and if they meet it, then everybody else will as well. If there's issues there, they need to determine what kind of changes they need to make. So I put those in there again for hourly and the qualifying offer. The qualifying offer, if they meet that, it's probably the lowest possible contribution someone could have. If it meets that, then they have some lesser requirements on the 1094, 1095. So for next year, if someone's contribution is less than $103.14 monthly, they automatically meet that qualifying offer. So I know I've thrown a lot at you. Again, I will stay on the line at least until 20 after 10 if needed for questions, and we will try to get anything else answered via email if we can't get to them today.
Okay, Barb, thank you so much. Great information. This is Shelley Brownell with Cornerstone in our Cincinnati office. A few questions that have come up here. We, of course, will make the slides available to all of the participants, and that usually happens sometime later today, if not early tomorrow morning. It will be posted on our website, and there will be a link for you to view the presentation. One of the questions that came up is weekly testing standard required for those with religious or medical exemptions?
Yes, so if someone is receiving an exemption, whether it's medical or religious, they still have to find a way to allow that person to still be in the workforce. So again, it could be that person working remotely, could be them needing to wear a face mask at all times. They can come up with different reasonable alternatives for that person to still meet the guidance, but in my estimation, they're treating them as someone who willingly doesn't want to be vaccinated.
Okay, and then we know that the employer is not required to pay for the cost of the testing, as you mentioned, but do they have to offer them the paid time off in order to go get tested, or is home testing sufficient for your testing needs, or how does that all work?
Yeah, the home testing, let me touch on that separately, but in general, the employer does not have to involve themselves with anything to do with the testing if they don't want to. So they can say that's on your own time. The employer can make the policy, but it's not required that they give them time off for weekly testing. Again, they're going on the mindset that that the best way to defeat the virus is getting the vaccine. So everything else, they're thinking if they push it back to the employee that it might be a financial incentive for them to get vaccinated. So that's the way the ETS was written. The home test, if you're not aware, they're available today. You can buy them over the counter, but you can also get them through either the public health department or even some of the public libraries, and you call and get a test, and then a telehealth worker walks you through that test and provides your testing results to the Department of Health. So that would be considered a valid home test. You can't just take one at home and bring it in and show the results. That employers, there's some language in there that's a little bit confusing to me, but it says that if an employer wants to administer home tests at their offices, they have to have a certain requirement. I have to dig into that a little bit more. But if we get that certification, we could run home tests in the office, but I don't know, that's awkward, and to me kind of defeats the purpose. Who's going to want to run testing for people every week? So home tests are potentially available, but in very controlled aspects.
Okay, thank you. And then, folks, we did want to share with you a document that we are making available to everyone, and hopefully you can see this on my screen now. Maybe Barb, you can acknowledge if you see that.
Yes, I can see it.
Okay. So as a member and actually part of the General Agency Council for the National Association of Health Underwriters, and obviously Barb serves in committees there as well, very closely tied to that organization. They have developed a broker compensation disclosure requirement form that we are going to make available for all of you, our broker partners. The first couple of pages will give you the disclosure requirements and just general information about the CAA and what we are required to do, just kind of reiterating some of those rules that Barb mentioned previously. It is not intended to be given to the client, to your clients, those first 2 pages, but you will see here as I scroll through this, this is where we start with the actual disclosure itself. So it can be personalized with your logo, your name, certainly with agency or with client information, etc. And then this is in a PDF format, and then you can see here it's fillable with all of the PEPM or commission percentages, coverage line, carrier, vendor, as was stated previously in the presentation. The first one was for direct compensation coming directly from your clients to you. The second would be the indirect compensation that you would be receiving from carriers and potentially other sources or vendor partners. Keep in mind that most of your commissions while working through Cornerstone are sent directly to you by carriers. So you should have your commission statements, which will give you this PEPM information by client on those statements. That's the first place you would want to refer to. Certainly there are a couple of carriers, if you do business with Anthem of Kentucky and or Humana, and some of the ancillary vendor partners that we work with and you as well write business with here at Cornerstone, we can actually provide that by you logging on to our agency portal, and you will see your statements there as well as that PEPM information for filling these out. The name of the game, folks, in case you did not pick up on this from Barb, is to get your 1/1 renewals set, done, and buttoned up before December 27th of this year, 2021. And then this becomes something that you need to get organized and ready for your 2/1s, but gives you a little more lead time. It is not believed that there will be regulations sent out, and it is not believed that this will be delayed. That's why we're bringing you this important message today. And it does require your action to start thinking about how you are going to get organized to put these forms together and get them to your clients, hopefully in the new year if you get those renewals done. Barb, anything that you would like to add to that? Or
no, again, that first page that you had, not the description, but that first part right there, just making sure that you're getting that information out to them, and you might want to consider taking this draft and coming up with a more full service agreement for your clients. But this will be a good starting point. We just took it as an opportunity to get a service agreement to answer all those other things that we wanted to put in place, whether it's here's what we do as an agency, here's what we don't do, and here's what you do. For example, if you as the employer really have the responsibility to check your monthly invoice, we'll do everything you ask, but really we need you to check that invoice every month. So it was an opportunity for us to address some other issues as well.
Okay, and then next question is, can you just kind of do a quick run through categorically of the regulations as to which are in force right now and which are proposed or maybe delayed would be a better way to put that?
Yeah, all of the things I discussed today are officially out as either regulations or laws. It's just the delays. So surprise billing is going to happen effective January 1st. Lots of pieces and parts of that have been delayed, but the general overarching, you cannot be balance billed for those services either in an emergency setting or you're going to a network hospital and there's out-of-network providers. Patients cannot be balance billed. The mental health parity rules, our clients really should be looking at those today. That is something that they're already auditing on, and it's important that they make sure that they can answer to an audit if someone were to step in their door. The transparency and coverage, every group should be having conversation with their carrier today to ask, are you going to have tools in place to help me put the transparency and coverage rules into effect, or do I have to start searching for a vendor? So as of January 1st, 2023, they're saying that website portion has not been delayed, and this falls back to the employer who's sponsoring the group plan. So I would be having detailed conversations with them to figure that out. The vaccine mandate, we should know by the end of the week or Monday. If that is not permanently delayed, we need to get on that because the December 4th day is going to roll around very quickly. And with the changes in the affordability, I would be discussing that with your clients today as well.
And just to let you know, we at Cornerstone are obviously talking with all of the carrier partners. It doesn't require that you reach out to those reps at this point in time, and we will be keeping you updated as to where they are on the transparency information and supplying that and making it readily available for brokers and for our general agency. However, if you have self-funded business and you are working with third-party administrators, as Barb mentions, I think it's critically important that you start talking to them right now. What are they doing to either get a vendor partner or to make that information available, you know, for your clients, because it will be that employer's responsibility. So another good question, Barb. So what if groups have already accepted their 1/1/22 renewal and they really don't have to do anything other than to verbally let that broker know or via an email, and then that broker in turn lets the carrier know that they're renewing as is? There's not something that doesn't need to be signed each and every time. Would that satisfy the requirement of getting out of doing the disclosure because it's before December 27th?
As long as it's done before December 27th, and again, we're back to that, what does it mean by a contract effective date of 12/27? The Department of Labor is saying it's back to the agreement with the client and the broker. And today, in most cases, we don't sign anything. The person puts our name on the carrier's application, but we aren't today signing contracts with most of our smaller clients. We might in larger group situations, but again, I would want that it's signed, just so you know. Again, there's going to be penalties attached to this if it's not done. So in our estimation, I would want if we're doing these agreements, even if you're using the simpler form from health underwriters, you should be putting that with a signature line so the group acknowledges they've received it. So that's why we're saying try to, as fast as you can, to get these January groups, which is the bulk of our business, get it wrapped up before 12/27. Anything after that, even the shorter form will help, but I would have a signature line so you can verify that it was received.
Okay, so get them done, and then you can worry about that at renewal next year.
Correct.
Do we have any information, Barb, yet on what the penalties are for not complying or you know, having other business issues take priority? For example, just the whole hiring challenge that businesses have right now, and you know, we are in the fourth quarter and all of those things. Any forgiveness there
So are
for
you
that?
saying on this provision or the vaccine
They haven't mandated, they haven't specifically stated that in the question, so maybe state for
Okay,
this
well,
provision
let
and
me
maybe
answer.
what you know about the vaccine.
Yeah, let me answer from both ends. So for the
Yep.
vaccine mandate, it's going to be a $14,000 fine per person. So normal OSHA rules say that if I come in and I find a safety issue, you're going to get a one set fine for that incident. This one is going to be by employee. So if you have an outbreak and 5 employees, or you have a situation where 5 employees haven't been vetted for their vaccination status, or they're not doing weekly testing, it's going to be $14,000 per person in that scenario. So that vaccine mandate is going to be pretty harsh. This specific rule on the broker disclosure, that fine is going to go back to the employer. So I believe it's going to come back through. It's going to be the normal ERISA guideline for breach of fiduciary responsibilities, and it could be up to 20% of an additional 20% on top of the normal fiduciary fine. So I believe to us it will come back through our E&O coverage that we failed to meet our responsibilities to that client. So whatever the group gets, they're coming back after us.
Got it. And so it will be significant.
Yes, I believe it will be.
The larger the group. Okay. Any other questions before we break? We really appreciate everyone's attendance today for this important message. Look for future broker blasts to come out that will send this form out to you all, as well as just any updates that we receive on some of these legislative items that we've discussed today. I don't see any more questions right now, Barb. Oh, broker disclosure is required on all size groups, correct?
And it's by the dollar amount. So it's anyone who is receiving more, that you're going to receive more than $1,000 or more in compensation. So direct or indirect, do you anticipate to receive $1,000 or more during their contract year? So if they're 2/1, any comp you receive between 2/1 and January 31st of the following year. So that will include most of our groups, especially if they have multiple lines of coverage with you.
Right. I mean, so we're talking a 3, 4, 5 life group, folks, on that, because if you do the math and say on average you have a $20 PEPM compensation, one line of coverage alone, as Barb describes, will take you over that $1,000 amount. So it's going to go down pretty far.
And I would, and Shelley, on that, I would be careful again for those groups that are even a little bit less. You might want to give them a disclosure, because you might get bonuses or incentives later in the year that would take that group over the $1,000 amount.
Okay, perfect. Thank you. And then we also, just a request in there, and we'll make sure that we do this as part of the broker blast. Not only will we provide the blank form of the disclosure here, but we'll also give you an example of how you might disclose that on there. And what it might look like in the, you know, there may be other services that you provide that we wouldn't know, of course. That's the reason Barb has suggested on a couple of occasions during the presentation a separate service provider agreement, but we can absolutely send a sample along with the broker blast. And like always, we encourage you to reach out to your broker advisors if you have further questions, or one coming up that you know you're going to run into needing to disclose this because it's going to run after the holiday.
Shelley, if I can add one other thing.
Sure.
One item you might want to consider is this does apply to medical, dental, vision, and any service that you have that's attached to that. We've made a decision as an agency that we're probably going to put everything on there, because we just think it would cause more confusion with an employer when we send them this form and it only has the medical, dental, vision lines on it. We're going to include everything, but you don't have to. It's not required. You'll just have to make a decision how you want to present it to your clients.
Great. And just one further question was, yes, we do record this. So when the presentation is made available, it will be actually a recorded version of that. So that should be available later today or first thing tomorrow morning. Barb, we sure appreciate your time, wealth of knowledge on all of these topics, and we appreciate what you do for the state and on a national level legislatively, and for joining us this morning to give this information to our brokers. With that, folks, we'll bid you a good day. And if you have any questions, reach out to your broker advisors, please. Thanks for attending. We do appreciate it very much. Goodbye.